Hello everybody, and let's talk about special interventions for a nephrectomy. Let's start with special considerations. First is remember, wrong site surgery is absolutely devastating for these patients. If we take the wrong kidney, then it is a possibility that our patient will not have any kidney function at that point, and we absolutely do not want to do that. So make sure you are checking your consents, that timeout is absolutely performed, and that you understand what you are doing. Second, make sure that you have blood products on standby. Your patient is typed and matched, because since these are large arteries coming into the kidney, we want to make sure that we have blood supply ready for our patients just in case we don't get the renal arteries completely clamped off before we nick them. Special equipment. The cell saver should be on standby. Remember that it's not just the renal artery that we are worried about. There are lots and lots of capillaries and other smaller vessels that enter into the kidney. So there is going to be a lot of bleeding. We're going to try and catch all of those bleeders and tie them off the best we can, but we are going to want to have the cell saver on standby if we need it. All right, special instrument sets. You're definitely going to need a major set with deep retractors such as Devers. However, most of the time we're going to use an Omnitract, a Bookwalter, or a Thompson retractor, just to have that self-retaining retractor to make sure that we have hands free to be able to do other things. We want pedicle clamps. Pedicle clamps are special clamps designed to go around the kidney, so they are the special shape, and they will clamp the pedicle of the kidney, which includes the renal artery and renal vein. And then we need our rib instruments on hold. Remember, our kidneys are up high. Even though they're retroperitoneal, they are up high, almost at the same level as the bottom rib. And so sometimes we have to either remove that rib to be able to get to the kidney, or we actually have to retract that rib up. So depending on where the patient's anatomy sits, we may need our rib instruments on hold. Special supplies that we may need. Vessel loops. We want to make sure that we know where every vessel going into the kidney is. Remember, lots and lots of bleeding. Kittners. This is going to be one of those meticuloteteostomies. It looks like we can actually just go in and cut out the ureter, cut out the pedicle and be done, but there's actually a ton of little vessels that go into the kidney. So we want our Kittners to be able to do that meticulous dissection of skeletonizing the kidney. And then we're going to need lots of catheters, Robinsons, Malacot, Pezzers, depending on what your surgeon uses, in the bladder, just to make sure that we are actually the kidneys functioning or not functioning, depending on how things go and the healing process goes. We want to make sure that we're giving our patient's body a break and that everything is draining appropriately, as they will be down to one kidney if we are doing a total nephrectomy. All right, medications on your back table. Honestly, you won't have any except for some saline. So you'll just have some saline on the back table. If we're doing this open, the incision is going to be too big for us to honestly use local and make a difference. If we're doing this laparoscopically, which most of the time we are now, you may have some local on your back table to numb up those port sites. Anesthesia is general, just because this will be an uncomfortable position for the patient to be in, not to mention it can be a long procedure. Positioning equipment. We are going to put our patient into lateral kidney position, which means that we are going to put them on their side and break the bed at the level of the kidney to pop that kidney up towards the ceiling. So we need our kidney braces, we're going to need pillows, armrests, a bean bag to hold the patient in place or other device, and some 3-inch adhesive tape. We are actually going to tape our patient to the OR bed. So what does that look like? If this is a left lateral position, notice that the patient's left side is on the bed. So when you are looking at kidney positions, left means, or whatever side, laterality, means the side that is on the bed. So we will actually be doing a right kidney with a left lateral position. So we want to make sure that this bottom leg is flexed. That keeps our patient from rolling over. A pillow between their legs. We will usually have a beanbag that comes up and around them right here that will hold them in place. We want to make sure that we have lots of pillows right here over the kidney brace to make sure that's padded. We're going to take our tape and tape it around their hip right here. Notice in here it looks like this is actually on the patient's skin. We are not going to put adhesive on the patient's skin. We will make sure that we have a towel or something down here so that adhesive isn't stuck to them. We're going to make sure that their arms are appropriately padded. We have these fancy little tables that hook to the arm boards here, this arm board, and then this will be another arm board up here. However, we can just stack pillows until their arm is in a neutral position. And then, of course, making sure that we have safety straps on their arms so they don't roll off. And we're going to flex the bed also. All right, tricky questions we just talked about. Make sure that you understand that left lateral means that we're doing a right kidney. Right lateral kidney position means that the right side is down, and so we're doing a left nephrectomy. All right, what kind of prep are we going to use for a nephrectomy? Most of the time we use ChloraPrep. We are going to prep the flank from mid-chest to past the hip and bedline to bedline. How we drape is pretty much just like how we drape for a laparotomy procedure. We're going to put our down sheet, 4 towels, and a transverse laparotomy drape. And our incision is going to be transverse over the flank. So procedure steps we've already done in another video. Counts we've done in our other video. Dressings, remember that we are going to try and do smaller dressings, so we'll probably do 4x4s in tape. Our specimen is going to be labeled kidney either right or left. Most of the time it is handled routine unless for some reason your surgeon wants to send it frozen, fresh frozen. Make sure you ask the surgeon before you hand the specimen off how they would like to send that. Post-op, our patient is going to PACU. Prognosis for this procedure is good if it's kidney cancer and we've caught it early enough. Just depends on why we're doing the nephrectomy in the first place. Complications, obviously bleeding is a huge one. Infection, damage to the vena cava, just because the vena cava is so flat and sometimes it's hard to identify. So make sure you're really helping your surgeon out there and watching for that vena cava. Wound classification, this is a clean case. We are not exposed to the outside world at all, so this is a clean case. Here's just your place to go for a video. Jomi has a great video showing a left nephrectomy from a living donor. And that is all for our intervention. I hope you all have a great day. Bye.